Now we're going to talk about the treatment for non-insulin dependent diabetes mellitus, or type 2 diabetes mellitus. The most important treatment for type 2 is diet control. Decreasing the amount of carbohydrates and sugars in the diet is the main treatment for type 2, followed by exercise. Diet control and exercise can actually keep the patient's sugar under enough control to keep the onset of diabetes from occurring. If that does not work, the next addition is oral hypoglycemics, and in some cases, insulin. Usually type 2 diabetics only use insulin in the case of illness, surgery, or hospitalization. Oral hypoglycemics are medications to help decrease the blood glucose. There are many different kinds. Sulfonylureas are a class that help insulin receptors function and increase the insulin secretion from the pancreas. Metformin is an example of a biguanide. It increases the muscle uptake of glucose and it decreases liver production of glucose. The meglitinides cause short bursts of insulin from the pancreas, and the absorption inhibitors decrease glucose absorption from the gut. Sulfonylureas such as glucontrol, diabeta, amaryl, and diabenese increase insulin secretion from the pancreas and, more importantly, help insulin receptor function. Other oral agents include glucophage, Actos, and Avandia, and these affect insulin release and use. Precoce and Glycet help prevent absorption of glucose from the gut. Why, the patient asks, am I on 4 drugs for my sugar? Insulin, glyburide, metformin, and Precoce. It just seems like too many medications. It's important for us to educate our patients about the reasons for the different kinds of medication. So, we need to teach that insulin is required for glucose or sugar use. Glyburide helps the cells use insulin better and helps the body produce more insulin. And metformin helps your muscles use more glucose and prevents your liver from making more glucose. Precoce, finally, prevents glucose absorption from your food. Warning: metformin can cause lactic acidosis. It is important to check kidney function in those on metformin. This can be done by checking a creatinine serum level. Also, metformin should be stopped temporarily if kidney function may be affected by surgery or IV radiologic contrast studies. Metformin should only be resumed once kidney function has been rechecked.